power is in you, in creating that knowledge, and that knowledge become wisdoms when it's embodied. And that's regaining power, that's claiming back, what we've been kind of colonized by, like this idea that like we come into an office and somebody's going to give us a pill. Mm-hmm. You have to perform at work, you have to perform at home, you have to perform in your relationships, you have to perform like all the time. Mm-hmm. But that's a man idea. Mm-hmm. We can't do the same performance as men will have. Like, that does not work.
Today I'm joined by Dr. Sara Cohen Fournier, a psychiatrist and one of the very first beta testers of the Get Obsessed curriculum. We talk about the menstrual cycle as a fifth vital sign, how stress and life transitions shape our cycles, and why embodiment, breath, and pattern awareness matter for mental health, especially through perimenopause and menopause. This conversation is so good and deeply, deeply human. Let's dive in. So what has been on your journey thus far?
Well, I think, for me, in terms of connecting to that part of the rhythm, there was really a shift, and I don't know if it's with COVID. I'm not sure if it was the vaccination necessarily, or the age, or many factors, or isolation, or overwork, and being in hospitals where all of this was happening, and just overstressed. Anyways, but there's definitely been a shift in my menstrual cycle since, and it's been so interesting to have curiosity in terms of that shift. Mm-hmm. And I think before I would have approached it with fear, and learning more, even with the background that I have, is something that's interesting, but learning more as an embodied experience makes such a difference. Because then it becomes real.
Thank you for saying that, and I appreciate it so much. And I totally get that feeling of fear taking over. Like, what is unseen, what is unlearned is, when we can't see it, when we can't feel it, it becomes a scary place. So where do we start? How do we start to find this embodiment to ourselves, to find this connection so that it doesn't feel like a scary space?
And I think in medicine, one of the things that's really fun, at least in the process for me to learn, was to be able to see the unknown in ways that people might not always think about. And we mentioned in the past this idea of like the fifth vital sign as our menstruation. And I think that's something that we forget, is we actually have more things that are seen that we can notice. And at least for me, it's been interesting to be like, oh, but do I listen? And listening means that I have to pay a deep awareness and also create a space of silence. And that's a place that often we don't give ourselves if we give it space.
I think the lack of space for menstrual cycles is one of the big blockers in that, where it's not discussed as the fifth vital sign anywhere. It takes a lot of people to open up that conversation, to understand that, like, think about like temperature. Yeah. Imagine you had 104 temperature and no one understood it. Yeah. And they were like, well, go to work. Yeah. Like, who cares if you're hot? Mm-hmm. And it's like, oh, all these symptoms are coming up for us, but we're never taught how to listen to them.
Medicine either isn't teaching it. Mm-hmm. Like, I mean, in my residency, I might have maybe had 2 classes, 3 max. That's on 5 years. In my fellowship, 0. In my medical school, maybe we had a few more. But that's nothing. Like, yes, there was like all of endocrinology that was like thought, but like it wasn't specifically on like, let's look at like how we approach and we understand and we treat, and we are able to like bring our consciousness to actually know. And I remember being like, oh, like mouse models were not used for studies until like the 90s that were women or female like mouse models. But that's wild.
And even so, in the 90s mouse models, they sometimes remove the sex organs because the fluctuating hormones
too complicated.
Too complicated.
It complicates things.
Yeah.
And of course it complicates.
Yeah. And it's so interesting as a psychiatrist, with all these modulating hormones in someone's body, how do you diagnose, treat?
We know it. Like, there are certain things, for instance, that will be known. Like, as for example, estrogen is protective of psychosis. Like, that's something that's like well known. That means that women, for example, in their pregnancy, when the estrogen levels are really high, they will less likely to have psychosis. But if they give birth, when they give birth, the drop comes really, really fast, and they're more at risk of psychosis. So these are kind of things that people will consider because they're just like
in the 2-3 days of your classes, this is what they spoke about.
Yeah, because it's just like, this is like really high risk. And that's a little bit of the thing that I hope new generations are going to come, is medicine is good at telling things when they're dangerous and severe. But for actually increasing health, or, you know, understanding more chronicity, or more like of the inflammation or the immune response or the autoimmune response, or things that are more like insidious, it's really bad. So I think that's why like the education and the popularization of information, and actually the democratization of like this knowledge is what's necessary, because I don't think the movement's going to come from the doctors. I think it needs to come from women themselves, or from men, or from people in general who are like, I want to understand what my health is. I want to be able to like to be my own primary caretaker and stop giving the power away. Because what happens when you go to see a doctor and you don't have that information, you're giving your power away. But the power is in you, in creating that knowledge, and that knowledge become wisdoms when it's embodied. And that's regaining power, that's claiming back, you know, what we've been kind of colonized by, like this idea that like we come into an office and somebody's going to give us a pill and that's going to solve our issues.
Yeah, how humbling it is to hear this from a doctor herself. And, you know, what a blessing it is that you've entered my life, and now I get to learn from you as well as part of this project, and how I wish you were my doctor. Like 10 years ago when I got my menopause diagnosis, because how many doctors, like, not bullied, I wouldn't say that, but how strongly in their convictions it was for me to get a hysterectomy without any understanding or allowing me to ask questions about it. But like in my own intuition was just like, no, it doesn't feel right. And how they wouldn't see me anymore because I wasn't following their protocol.
Yeah, and it's very tricky. Because the thing is that you stood up and you said, I know what's best. And doctors don't like that. You know, it's like, we think we know best, but that's not true. And unless we really start putting like critically in our own mindset, like the patient as the primary person who makes a decision, and I'm only there to help that person and guide them in that decision and bring the service. And that's a little bit the same thing with our relationship with our cycles, is that unless we come and tune into this knowledge, we're disserving our integrity towards ourselves. And we're pushing aside these information that could unveil like some information that will allow us hopefully to blossom, to arrive to our full potential, and to connect also with others. Anyways, hopefully like for a better humanity.
Yeah, that would be wonderful. But I think also like in service of our later years, right? When we're menstruating, it's like, how do we preserve our health for when the drop comes, when these hormones aren't going to be circulating in our body, to protect our mental health? Like, how do we make sure that we're embodied enough to understand the symptoms and the signals that they're giving us, so that, you know, wherever you are in your cycling years, like when eventually it will stop. I'm like, how do we protect those years?
And it stops at every cycle, right? There's always that drop at one point that happens. And that's where usually a lot of women at least talk to me about their problems in terms of like, oh, do I have like PMDD? Like, is this something that's going on? And like, is this PMS or is this like more than that? And then you actually have to track it for each cycle. And that tracking allows for people to kind of be like, again, I'm going to bring awareness, this idea of like, oh, what's actually going on? And most of the time, by that act of acceptance first, brings more acceptance also to the families. Because a lot of time, women might be fine with having the symptoms, but it's the entourage who's complaining. And it's shifting the dynamics that are usually within the family systems too, to bring in that container of, oh, you're not going to function like you usually do, and it's okay.
So they don't allow rest or space, so the woman feels that she has to continue and kind of bypass her own signals.
Yeah, because women are still in this position right now where there's been this idea of like, you have to perform at work, you have to perform at home, you have to perform in your relationships, you have to perform like all the time. But that's a man idea. You can't do the same performance as men will have. Like, that does not work.
Yeah, we're not on that cycle. We have it in our cycles, but we have a secondary, and we have to respect that.
Yeah.
Something that Michal spoke about that I would love also your take on, like, and I think it is important to listen and be guided by your own embodiment and to take up space and use your voice to educate the people in your family to say like, this is my time.
Yeah.
But something that I want to speak about is serotonin, because something that I asked you in one of our calls is about tryptophan and how that enters the body and how it can lead to like neurotoxic, or how it can create serotonin and lead to the happy hormone, and how that can kind of help maybe in the later phase, like when the hormones drop, there's still hormones circulating that keep you feeling good enough to explain that you need rest. And so I would love for you to explain like that process, like the tryptophan and how it enters the body.
Well, it's a complicated process because I think we don't necessarily know fully to the extent of what are the factors that completely like make that loop. But tryptophan will be absorbed, right? And only a certain percentage, I think it's very low, will actually be transferred to serotonin. And the majority of it will go into a pathway that will create more like inflammation. What they kind of research has been showing is this idea of like, if you're able to find a way in which like your inflammatory system is the lowest, then you're at better risk of not having that pathway being taken. But yeah, and I think one of the element, and I would have to check up on it again, but it's really like in terms of your diet, really being able to have this kind of diet that will allow for the lowest inflammation possible in your body, which usually people say it's kind of like the Mediterranean diet, or like having like a certain amount of omega-3 that can be introduced, as well as like making sure like your sleep hygiene is good, going to bed at earlier time, being exposed to sunlight, spending time with people who make you feel good, being able to like connect in meaningful ways, and less screen time. I think these are all things that will eventually decrease a bit of that inflammation response that will be present. And sometimes we think these things are silly, but it's one of the most powerful techniques that I work with in my practice as a doctor, and that works, is breath. And sometimes I say to patient, I've studied 14 years to come and teach you about breathing. Yeah. And, and they're like,
follow your breath, follow your bliss.
And like in India, people spend their life learning about prana. Their life, just to be able to work with their breath.
Yeah. They're storing energy in their body.
And it is such a powerful tool because that will decrease cortisol. That will allow for your parasympathetic nervous system to be regulated. That will allow for that digestion to be kind of also easier. And it's free. Mm-hmm. And you can do it at home, and you can do it in your car, and you can do it anywhere.
All the time.
All the time.
I don't think it's silly at all. I think that is, something that I practice all the time. And I think it connects all the dots to everything else that you said, mm-hmm. right? Like nervous system health is so important. And if you can't talk to your family about needing space, if you can't connect to the people around you, if you're not able to sleep because your nervous system is restless, like what is the easiest low-hanging fruit to go to is to sit and breathe.
And for me, it's important to say that because I see a lot of people who are going to be like, oh, I'm going to get this test that is going to be costing me like $400 to test my hormones at different levels, and then maybe I'm going to get some bio, like a supplement, and I'm like, okay, maybe maybe it's going to be very helpful. But have you tried to change certain things in your life?
Have you tried to breathe?
Have you tried to breathe? And most of the time people are like, oh, I don't have time for that. Mm-hmm. Or, oh, I forget. Or, oh, I can't put it into my schedule. And yeah, it's a habits that are difficult to put into place, but they're, very important. And it's true that changing a habit or taking that consciousness and bringing it, because the thing is that once you have the awareness, once you have the consciousness that this is helpful, you can't really turn back. You have to apply it, and you have to put it in practice, and you have to do it, and you have to do it, and you have to do it. And there's no miracle solution. But the thing is that the miracle happens, and you're just, eventually at one point, you're like, I understand. Mm-hmm. And then maybe, of course, there's supplements you can take, or there's medication you can take, and there's maybe the hormone replacement therapy for certain people, depends on whatever your story is. Mm-hmm. But I feel it's kind of like you work by palier, like you work one step at a time, and you continue bringing curiosity in that.
I love this approach. Yeah, I think it's so important to go slow, to move slow with your health, and really understand every layer that you're unpacking and also adding on. Yeah. You mentioned HRT, and I would love to dive into it and I don't think it's talked enough about, because some people, when they're on birth control, go through a lot of mental illness, mm-hmm. and HRT is now like, everyone go on HRT. Yeah. Can there be a side effect of mental illness on HRT? Like, has there been studies? Has there been correlations?
I haven't seen it. Most of the thing that's talked about in terms of that is mostly like the cardiovascular risk and like cancer risk, like especially if you're high risk. Like, I mean, those are the things that are really like, again, medicine is really good about these things that are dangerous and severe. But in terms of mental health, I'm not sure what the studies have shown. And I think because now there's an increased percentage of women who are going to be like proposed to go on it, it's going to be very interesting. I think we're also seeing that the women who are in their 50s today are starting, treatment, or maybe early 40s. It's a different generation than the women who have had it in the past as well. Like, we're also talking about a generation gap, mm-hmm. where people are also more comfortable about mental health, who also know a lot more and know how to get more help as well. So there might be some
so can see the signs coming.
So I don't know if that might be a confounding factor, but I would have to go back. I'm not sure.
Yeah, because I would love to understand just see if there's been any research on mental health and HRT, just because I know a lot of women that I've been working with, and I'm in this program right now, and there's a lot of women talking about it because they're all going through perimenopause, mm-hmm. and menopause, and, people are very excited about it, but there is this fear of mental health issues because of how they acted when they were on birth control. Any supplementation of hormones, they felt that it really interacted.
If like, for instance, like in depression or in anxiety in perimenopause period, actually, like the recommendation sometimes is to supplement with progesterone or estrogen, specifically in that period, because of that drop that can be too drastic. But I don't know how it would compare to like the doses that are given in HRT. That's what I don't know. But there's definitely like an increased risk, like in that moment of transition in terms of your mental health, about dropping, like in terms of just because of sleep changes, because of all these changes also in like the physical state, and then the anxiety rising, and just like, I think one of the things that we forget about is that it's an important phase of life. And again, one of the things that happens is like you have to go get the resources in another way. So in your 20s, you can be a bull. You can decide, like, even if I'm not feeling well, I'm just going to get up and like go. In your 50s, you have to find another resource. You have to tap into something else. And if you don't make that switch of tapping into what is the next step for your life, there's going to be sometimes like these transitions are going to be harder. And that's why like I find the mindset in which we approach phases, like it's kind of like not wearing winter boots in the winter. You need to be ready. Like go get yourself winter boots, you know, like
yeah.
Or just like wearing the winter boots in the summer. You have to remember that these are cycles, and in cycles there's seasons, and in those seasons, if you approach it and you're like, oh, I am getting ready for this season and I'm not mourning the last one, but I'm actually excited for what's to come, then the symptoms become more bearable. Because the focus of it, and that's something that's been well known, is the focus and the attention and how we talk about these things will change also how we live it.
I love that example. I think it's like, you know, when we're kids, we're in school and it prepares us for adult life. And then in adult, like in our 20s, we're preparing for our 30s. And in our 30s, we should be preparing for our 40s. And like, how do we take that health and learn the embodiment to understand the changes, the shifts that are happening? And I speak about this a lot with my students. It's like women have a gift, and it's a gift of awareness, and kind of sucks because once the door opens, it's like, you can't close it, and it's there, but we have fluctuations all the time that are happening within us. So we're going to be a little bit more, you know, awake to those shifts. And what we do with that awareness is our own prerogative, you know? But what I'm hearing is in what you're saying is that it's important to listen. It's important to understand that every fluctuation, maybe not important, but for the moment, but will serve an importance in the next decade or the next phase or the next season.
I kind of like to think about like your 20s prepare you for your 40s, your 40s for your 60s, and your 60s for your 80s.
Okay, so like a missing decade, a gap.
Well, it like almost a generation. You know, it's like that. It's like a 20. Like think about it, like.
When I was 20, I was not preparing for my 40s.
And then your 40s hit. But imagine if we were guiding people to actually like really prepare. And in your 40s, if you prepare for your 60s, it's going to be a very different story. And if that preparation starts in your 40s, then your 50s are going to arrive, and you're going to be like, yeah, I can like, you know, tap into my knowledge. I can tap into that awareness. I can focus and really see what's important. And eventually the goal is to access something else. Because you've created that space of openness. You've created that emptiness that's present where the whispers of the wind can talk.
I love it. It's rare that as a 43-year-old I can say like, oh, when I was in menopause and now that I'm cycling again. It is a very strange sentence to say, but when I went through menopause, like there was, I mean, of course I was devastated, and you know, I had to release so much grief through it, change my relationship to femininity and what that meant to me. But one thing that I really loved about being in menopause is that I was no longer in the turbulence of my emotions. I was able to pause and bear witness to myself before acting. And I think that is the wisdom, the pearl of menopause, is like, now we get to gift the wisdom of like, it's going to be okay. Like every windstorm is going to settle and it's going to show something beautiful from it.
And you also have to remember that there is also, like, in terms of like Chinese medicine talks a lot about how important those changes in the bodies are, and especially like the menstrual cycle, like in terms of like that flushing. Every like month, that we like it or not, we have to release. And that's a very powerful metaphor of just being able to like just wash away whatever has been, in the turmoil of the emotion. But then in menopause, you don't have that.
No.
So you have to find other ways in which you can find places where where the garbage is and put it away.
And so, I mean, how would one do that without a release? I remember like when I had my diagnosis, I was going through it and the rage was out of this world. And what I wished for was that release. I kept like praying for just a release. And then over time it settled and like I stabilized. And so it just kind of left. But during that time, like, I mean, I was young. I had no idea. In my 20s, I was not preparing for my 30s to go through menopause. And so like, I didn't know, But one thing that I said today, and I think it's like, it makes sense, every time, like in this context too, it's like, I always thought life was linear, and I don't believe that anymore. I believe that whether we're cycling or not, we're always going through cycles. And the bleed is a beautiful release and reset. But I think, and I feel very strongly in my body that when I'm doing something new, it is the first iteration. But when I go back to it, it's a second iteration and the return, and then it keeps cycling. And every time I come and I return, it's like, oh, what am I learning now? And how am I witnessing myself now? And so maybe that is a way of releasing.
Yeah, and or just what you're bringing with the practice.
The practice okay, so this morning, just to give context. So Sara and I, along with Karina and Michal, are on a wombat retreat, menstrual cycle retreat. And so this morning I taught a practice, and the practice is each song we follow a different rhythm, a different movement, and we open up our body in different ways, and we explore different feminine energies within the body. And at the end we release and let go. And so that's what you're talking about.
We are not in a cult.
Yeah, we are not in a cult. We just did a movement practice.
But that's like one of the things, right? To have these embodied experience and rituals or, practices that are there to have that like really embodied experience where that can be released. And it's the same thing about like that, like if you have the knowledge and you're like, okay, let me remember that I have to find a way that it has to come out, then you'll find a way that it has to come out. But you have to make that ritual. You have to become your own like authority within that. And that's something that like we forget because we're stuck on the frustrations. But the frustrations are there to remind us to look at all of these things. Like they're important guidelines for ourselves. Like emotions are there just for us to be able to be in our compass.
I love so when I came back into cycling, of course, I grew my voice, I grew my practice, and something that came to mind when you were talking is like the mouth, like the ears, nose, mouth, throat is like direct connection with the pelvis. And so one of my practices is releasing the voice. And so I think it's interesting, like as we bleed every month when we're not bleeding, is it the opposite? We release through the throat and we allow ourselves to express whatever needs to be expressed. So, during those 30s, when you're raising a family, when you're at work and you don't have the voice to tell your family that you need space, Maybe that's the voice that you need to practice, because in your 40s and 50s, you're going to use that voice and you're going to need to set those boundaries.
Exactly.
Whether it's through a yelling practice, a singing practice, whatever is going to allow it to come out.
And then that brings that balance of just knowing that you're in some ways manifesting that change that needs to happen within your body. And just as it drops a little bit in that end of the cycle, then eventually it will completely drop. You're not going to be that much of a different person, so most likely your symptoms are going to be similar. And you can use that wisdom that you've been collecting as you prepare for. But again, that's not scientific knowledge. That's just,
that's not in the anatomy book.
That's just a hypothesis that I'm putting forward to just be like, let's own our ownership of our own being.
I love that. I want to come back to the medical books, because in our first conversation, when we were talking about fertility and the menstrual cycle, like they talk about the alien or the foreign invader that comes in.
No, that's terrible.
Yeah.
The history of Obstetrician is just the first textbook of, I forget the name of the author, but the first obstetrics textbook described the fetus as a parasite.
That's what it was.
Yeah.
Oh my goodness. Yeah. That was like jaw-dropping.
Yeah.
Why would they call it that?
I mean, I can go on and on about what we've done to female knowledge. Ancient female and women knowledge was eradicated. And what, like, the wise women, the sages-femmes, the midwives, only recently have been able to come back. But they used to hold that amount of knowledge that people had and pass it on from generation to generation and generation and generation. And that was completely pushed to the side into a place where the way that we birth is made for the doctor to be comfortable. That position with the legs up, that's not anatomically viable for the baby. I mean, it works, but it's not the best, most efficient way, but it hurts less the doctor who's sitting. And that's known. Like, that's in medical textbooks, or historical textbooks, about that kind of patriarchy that's been present, that we've taken a lot of. I mean, women were burned on stakes, like the wise women were called witches, and there was all of that. The healers were chased because others wanted to have these very strict and scientific protocols. And I mean, I love science in many ways. I think there's so much to learn from. And it's so rich, and it brings so much knowledge and curiosity and more knowledge, and it's amazing. But you also have this whole intuition. Like how do we know that, we still don't know how Tylenol works.
Really?
No.
What do you mean?
We don't.
You don't know how it works, assimilates in the body.
We don't know what exactly it does for it to work. But we know it works, so there's certain things that, we still don't know, but we still practice. And that's okay.
Whoa. And so my question to you is, as a female doctor, how do you feel in this world today?
Well, I'm lucky. I get to love my patients, and I get to be okay loving my patients, and that's the most beautiful. And I even had teachers who told me it was okay to love my patients. So I think the profession that is changing. There's an evolution that's happening where you can
care for your patients. Oh boy.
Well, but more than care, have that relationship. That's a relationship of deep connectivity. And for me, that's the most important. The rest, yes, of course, the medication helps, the therapy helps, the team helps, all of it. But for me, where I get the most out of my days, and hopefully my patients do too, is when we've connected. There was a soul-to-soul connection, and you feel it. Like there was a moment, and the room just kind of calms, and usually the patient kind of smiles because like there was something that has been struck, and you're like, oh yeah, we're landing something that is going to make a real difference for that person.
That's beautiful. Yeah. We were talking about women, and something that alleviates a lot of symptoms is being heard and seen, because so often we're not. And in our pain, all we want is for someone to be an active listener.
Validation.
Yeah.
Validation. That's one of the ways in which emotional regulation really, really helps, and has been like starting to be shown a lot more, especially in parenting, of how do we validate the child and their kind of experience. And a lot of people that I've accompanied have a lot of trauma in their history. Well, one of the things we have to do is learn to find their own inner validation. And I think about my brother in that time, because when he was younger, he loved Nutella, and he would put a lot of Nutella on his toast. And so I have this idea, whenever I'm doing validation to patient, I usually like to spread a lot of it. And that usually allows for the emotion to kind of drop. And one of the things that's important is actually naming the emotion yourself. Decrease that intensity by about half. So you yourself being able to be like, I was in rage, already is a form of release. Or I am anxious, or I'm feeling tightness in my throat, and it's related to that frustration that I was living, and all of a sudden allows for your system, your emotional system, to release. And then from there, connecting to this place of, okay, now I can observe what's going on, and I can proceed in the right action. And there's great, like DBT skills are just amazing. I think they should be taught to like all children. And
what's DBT?
Dialectic behavioral therapy.
What is that?
It's wonderful. It's like this woman, Marsha Linehan, who had this amazing experience that she started through like working through therapy. But what happened is that she was diagnosed from an early age with like what they thought was schizophrenia and like psychosis, and she was hospitalized for years, starting at 14, and then she was like, this is not who I am. This is not what's going on. And she ended up going to a church and asking God for revelation, and came into this kind of the field of psychology, and was like, actually what I have is a personality disorder, like a borderline personality disorder, where emotions are like roller coasters and you see things black and white. And she then went on and was like, okay, well, what can we do about this? And so she studied Buddhism and took a lot of the principle of Buddhism, like radical acceptance and mindfulness and effective communication, and made all these modules. And it's so good because it brings us the understanding of what's going on in our emotions, and being able to know that we can hate and love at the same time, and it's okay. We don't have to necessarily like be holding just one end. We can be holding both, but that takes some work.
Understanding the spectrum of the dichotomy, the polarization.
Exactly. Yeah. And so in a lot of the work that she's done, like that's been kind of really effective for people who have, the emotions that go up and down, like the borderline personality disorder, but it helps a lot of people in being able to engage with the others in different ways, and learning also how to engage with yourself and be attuned to your emotions. And once you start to see this, it's kind of like the way that I like to conceptualize it is, imagine emotions being kind of like the ocean. They're water, right? Well, when you have high emotion, the wave kind of sweeps up. And your thoughts are like wind. So if you go with your thoughts increase like that wind power, what's going to happen with the wave? It's gonna like yeah, you're gonna have a tsunami by the end of like the 10 minutes that you're gonna be with yourself, instead of just riding the wave. And so those skills allow you to ride the wave, to just be like, oh, I'm feeling anger. And I don't have to start being like, but this person did that to me, and now I'm really upset, and and then that is what fuels the anger.
And to come back to basic living and understanding who you are and what's going on in your body, and just being aware, being fully embodied in all of what's happening, so that you can say what you're feeling and be validated in the experience, so that the nervous system doesn't start to charge. It doesn't dive so deep in the sympathetic tone that there's no way of coming back. It's like right away you catch the wave. You're like, oh, I'm just surfing on this beautiful wave, and I'm riding it to shore, you know. And I think that it's the greatest gift of being able to really understand yourself and really fully come into your own power and be the empowered person that sits in front of someone and says like, no, that's not the truth, and maybe I don't need your validation because I have my own validation, and I'm going to speak to my community that I've curated and collected, and they're going to validate my own experience because they know me and love me.
But that doesn't excuse you to be rude.
It doesn't excuse you to ever be mean or angry. I mean, you can be angry, but maybe don't take out your rage on a person sitting in front of you. But I think it is really important. Like, you could be the wise person sitting on top of the mountaintop. Like, emotions are going to come through, and hormones move through our body in all the different ways, and so it's important to understand the cascade and just name it, call it out when you feel it.
And if you don't do it, then don't expect others to do it for you. And that's like a long journey, and I can attest definitely of like wishing that my partner or my mom or my friends knew what was going on for me.
The expectancy. It's like really to utilize the voice, to empower the throat, because it is a mirror of the pelvis, of the pelvic floor, of the reset, of the bleed, of the building, of the letting go, of the calm. It's like, this is how we communicate it.
And so it's kind of like there's an evolution within yourself that hopefully happens by that age.
So we can stay calm and carry on.
or like be wild.
I love that. It's like every cycle is a practice to get better, to ameliorate your senses and your embodiment tools, so that it can take you on into your later years.
And then imagine if like people in their 50s and their 60s, and I really like find, I don't know if we'll be that when we arrive there, but I really wish that like we can find ways that in your 70s and your 80s you're still an active member of society. Because I don't have
we can have a whole other podcast conversation about this, because I think it's like, I don't want to go into the rabbit hole of like what society kind of pushes on the elderly, but like, I think it's every person can live such a beautiful, full life, embodied life until their last exhale. And it takes us back to the breath. So breathe fully and take time with yourself, take space for yourself, because that's where you're going to learn and you're going to be able to have these conversations.
The dialogue, the inner dialogue is so precious if we just sit and listen.
Oh, I love that. Thank you so much, Sara. This has been such a beautiful conversation. I love it. So again, thank you so much for your humility, for your humbleness, for your I just love you. I'm so happy that we got to chat today.
I love you too.
So thanks.
Thanks for having me.
Yeah.
And we end this by a hug, by the way.
Yeah.
Because
We're
that's
hugging.
important.
Yeah, we're gonna hug right now.
Those are healthy hormones.
Oxytocin.